Pneumonia is more than just a cough. It's an infection that inflames the air sacs in our lungs, filling them with fluid or pus. Imagine battling fever, chills, and a relentless cough, all while struggling to catch your breath. In the elderly, it can manifest as confusion rather than the classic symptoms, while infants may show irritability and rapid breathing. Diagnosing pneumonia involves listening to the lungs, chest x-rays, and lab tests to identify the culprit. Treatment varies. Bacterial pneumonia often requires antibiotics, while viral cases may need antivirals and supportive care. Prevention is key. Vaccines, good hygiene, and a healthy lifestyle can significantly reduce the risk. Understanding pneumonia empowers us to take action and protect our health.